Nishta Gandhi's daily routine includes riding the bus to her job at Superstore, where she works as a grocery store clerk.
All the time we have to be cautious.
She'd like to also get routinely tested for COVID-19.
We need to do that. So just add one more thing to your routine.
As of today, anyone working outside their home in Saskatchewan can get a test, no symptoms necessary. But Dr. Alex Wong says he doesn't recommend it to most people, at least not in Saskatchewan.
If you're in Ontario or Quebec, where rates of community transmission presumably are much higher, they still have a lot of cases, this is different. And when the prevalence is higher, then it actually does potentially make a lot more sense to be screening more aggressively asymptomatic individuals to get a better sense of sort of what your rates of community transmission actually are.
So why not here? There are so few cases to find in Saskatchewan, they'd be competing with testing errors that show false positives, distorting the picture.
Which means that you actually have more false positives than you do true positives, which makes it a lot more difficult for us to interpret.
Then there's the issue of negative test results for asymptomatic people.
So that's a negative test right this second. Tomorrow, if that person is symptomatic, that could be COVID.
Manitoba also has a low prevalence of the virus.
We'll probably not be at any point where we just do large, widespread, indiscriminate asymptomatic testing. There's really low value in that.
What is having value for some provinces is testing asymptomatic people in high-risk groups, such as homeless people, hospital patients, or anyone inside a long-term care home.
As Regina has very little case, so you don't feel that scared.
So widespread testing of people without symptoms is expected to bump up testing numbers here. It's just not clear whether it's for public health or public relations. Bonnie Allen, CBC News, Regina.
Okay, so I think now is a good time to bring in infectious diseases specialist Dr. Isaac Bogosh, because Dr. Bogosh, do I have it right that the goal is not necessarily to just test as many people as possible?
Yeah, that's completely correct. The goal is to really have focused testing in groups that are at greater risk for this infection and in areas where if the infection is introduced, it can spread like wildfire. So places like long-term care facilities, homeless shelters, refugee clinics, prisons. The goal is, testing asymptomatic individuals in those settings as really a surveillance system to make sure that the virus isn't introduced. And if it is introduced, we can jump on it quickly to prevent a much larger and devastating outbreak in those settings.
Right. And for those folks who do get tested, I mean, how often? Because, just because you're virus-free one day doesn't mean you won't just catch it the next time you go out.
Absolutely. Fantastic point. And they will have to figure this out moving forward about what's an acceptable frequency of diagnostic testing, because a surveillance program isn't just a one and done program. You have to make sure that there's a regular interval of diagnostic testing in those settings, and because the virus can be introduced at any time along the road. And certainly in the pre-vaccine era, these groups are going to be at higher risk for infection to be transmitted in those communities.
Right. Dr. Bogosh, thanks so much for your insights, and stick around. We're going to talk to you a little bit later in the program. Thanks so much.
Sounds good.